Good evening, everyone. The chairman is excused from tonight's public hearing. The first order of business is the election of a temporary chairperson. Do I hear a nomination for Mr. Peter?
Nominate Dennis Feeney to act as temporary chair.
Thank you. Is there a second? Any other nominations? Yes, sir.
Well, just point of order, should we do roll first before we do this?
No.
We do this before roll?
Yes.
Oh,
We have to have a chairman to direct me.
makes sense, thank you.
You're welcome. All in favor signify by saying aye. Aye. Any opposed? Thank you. Mr. Feeney, would you kindly take the chair? Thank you.
Yes, thank you, Mr. Clerk. Will you please take the roll?
Dustin. Here. Bergdorf.
Here.
Chapman. Clay. Cleary. Collins. Mr. Collins. Camiso. Here. Cunningham. Here. Tomallowitz. Drake. Epicoro.
Here.
Asia.
Here.
Feeney.
Here.
Fine.
Here.
Grimm. Here. Joyce. Andrew. Joyce Raymond. Boone. Here. Lekakis. Lockhart. Moriello. Mayo.
Here.
McLaughlin. McLean Lane.
Here.
Miller. O'Brien.
Here.
Hurley.
Here.
Peter.
Here.
Lotsky. Here. Reedy. Reinhardt.
Here.
Ricard.
Present.
Rosano.
Here.
Simpson.
Here.
Smith.
Here.
Tunney.
Here.
Ward.
Here.
Whalen. Here. Willingham. Present, Mr. Chairman.
All right, we have quorum, thank you.
Thank you.
The governing law directs that we hold a public hearing prior to the passage of certain legislation. In addition, our rules prohibit members of the public from questioning legislators and prohibits us from questioning you. Speakers are called in the order their names appear on the sign-up sheet, and speakers are permitted 3 minutes tonight to express their views on the relevant topics. Clerk, please read resolution number 242 for 2023.
Public hearing on proposed local law G for 2023. Local law of the County of Albany, New York, amending Chapter 242 of the Albany County Code to prohibit smoking and vaping of tobacco or cannabis products at county properties and in county vehicles.
Are there any speakers on that?
Yes, there are.
Please read the first name.
Simona Fish.
Hello. I am offering public comment on behalf of Capital District Tobacco-Free Communities, a program funded by the New York State Department of Health to promote tobacco-free living in Albany, Schenectady, and Rensselaer counties. Our program has 3 primary goals. 1, to reduce tobacco use overall. 2, prevent youth initiation. And 3, protect people from exposure to secondhand smoke. My comments are focused on the benefits of prohibiting smoking and vaping of both tobacco and cannabis on Albany County property. We've worked with more than 20 Capital District municipalities to make their properties smoke and vape-free, and we applaud the county effort to expand their current policy to include e-cigarettes, cannabis, smokeless tobacco, and all county properties. Local Law G states its intent as follows. The Albany County Legislature finds that each year 41,000 people die prematurely from exposure to secondhand smoke. According to the U.S. Surgeon General, there is no safe level of secondhand smoke exposure. E-cigarette aerosol can also contain harmful and potentially harmful substances including nicotine, ultrafine particles, flavoring chemicals, volatile organic compounds, and heavy metals. County employees and visitors to Albany County buildings or vehicles should be able to work and seek services without being exposed to secondhand smoke or e-cigarette vapors, aerosols, and smells, end quote. There is no safe level of secondhand smoke exposure. Commercial tobacco smoke contains hundreds of harmful chemicals. There are more than 7,000 chemicals in tobacco smoke, including hundreds of chemicals that are toxic and about 70 that cause cancer. Even brief exposure can cause serious health problems. Secondhand smoke can cause coronary heart disease, stroke, and lung cancer in adults who do not smoke. Local Law G creates a perimeter of 25 feet from the entrance that prohibits smoking. Perimeter policies are not effective. Perimeter policies put the onus on individuals to use their judgment of distance, which can vary from person to person. Perimeter policies do not keep smoke and aerosols from drifting into the buffer zone, and perimeter policies are much more difficult to effectively communicate and enforce. Creating smoke-free properties is the only way to prevent exposure. Smoke and vape-free policies that restrict the use of all products which can be smoked and all products that can be vaped are the most beneficial to public health, to environmental protection, and also help to firmly establish a tobacco-free norm. The inclusion of smokeless tobacco in the new policy language provides significant protections for maintenance workers and the environment. Smokeless tobacco is harmful to users, and smokeless tobacco byproducts contain at least 24 carcinogenic chemicals, creating a health and safety risk for maintenance staff. There are no safe forms or levels of tobacco use. There are significant benefits to prohibiting the smoking and vaping of tobacco and cannabis on all county property. Local governments have a special responsibility to make public services and programs accessible to all members of the community, including those with health conditions that can be exacerbated by exposure to secondhand smoke and e-cigarette emissions. Over the years, our office has fielded many calls from city residents whose access to public services was impeded by the presence of secondhand smoke near city buildings and entryways. CDTFC can provide information and technical assistance on policy implementation, including community education to maximize compliance and free custom signage to help communicate the policy. Prominent signage is the primary way to communicate the policy, and it creates an expectation of all employees and visitors that they refrain from smoking while on county property. Local municipalities can also get support from the Public Health Law Center, which is contracted by the New York State Department of Health to provide law and policy expertise related to commercial tobacco control. All these services are funded by the State of New York Tobacco Control Program and are free to local governments. Thank you.
Thank you.
Teresa Zabretsky.
Thank you, and good evening. I'm Teresa Zabretsky, and I'm also with Capital District Tobacco-Free Communities, and also providing some comment on Local Law G. Want to talk a little bit more extensively about 25-foot perimeter provision in the policy. As my colleague said, the intent of Local Law G is very clear and a goal that we really support, and that's making all county services and resources more accessible by preventing exposure to harmful secondhand smoke and aerosols. And as someone who has for years fielded calls from people throughout the Capital District who are concerned or have been concerned about their own exposure to secondhand smoke and aerosols on public property, this will come as very welcome news, especially for those who have allergies, asthma, or other conditions that can be particularly aggravated by that exposure. The inclusion of not just tobacco and cannabis, but other kinds of things that can be smoked and vaped in the definition in Local Law G is also something that's very helpful, since constituents in smoke from all sorts of different plants and aerosols from vapes, regardless of what's being vaped, can create problems. So the comprehensive definition is also very good news for your constituents. But if the intent of the proposed law is to prevent exposure to secondhand smoke and aerosols, it's important to consider the limitations of a policy that attempts to achieve that by establishing a 25-foot smoke and vape-free perimeter from entrances. For one thing, it requires individuals to make a judgment about distance. You ask 5 different people what 25 feet from an entrance is, and you're likely to get 2 or 3 different answers, and maybe even 5. Boundaries that require interpretation, that are subject to interpretation, make individual compliance with those boundaries somewhat subjective. But there's an even bigger concern, and that is that in outdoor settings, smoke and aerosols can travel much farther than 25 feet. I have a neighbor who smokes on his deck, which is in the back of my house, and he's at least 75 feet away. I keep the windows towards his deck closed, but his smoke regularly comes into my house via my side windows. And the same is true for neighbors on either side. So buffer zones for smoking and vaping simply aren't effective at really preventing unwanted exposure to secondhand smoke and aerosols. There's no policy that's going to be 100% effective, but making an entire property smoke and vape free, which would include parking lots and sitting areas, lunch areas, lawn areas, that's the best way to maximize the public health benefits of having a smoke and vape free policy. And it's also easier to communicate, because saying this is a smoke and vape free property, period, makes it easier for people to understand, it makes it easier for people to comply. When you have a building that has a front door that goes right out into the public street, that's where the additional perimeter policy can be helpful. It may be property over which the county doesn't own it or have authority, but if it's possible to extend to have a 25 or a perimeter policy from an entryway in addition to property, that can sometimes be a really helpful thing to do.
Yeah. Your time's up.
Okay. I'm glad to see that the law requires posting signage. As my colleague said, we provide signage at no cost to the county. In fact, any of the tools or implementation assistance we provide is also free of charge. Thank you for allowing me this time. Thank you.
Next speaker.
That's all the speakers.
Is there anyone else in chamber who wishes to speak on local law G for 2023? Hearing none, public hearing is now closed. Clerk, please read resolution number 297 for 2023.
The public hearing of proposed local law H for 2023. The local law of the County of Albany, New York, amending local law 8 for 1997, granting a partial tax exemption of real property owned by persons with limited incomes who are disabled in accordance with the provisions of real property tax law, section 459C.
Any speakers signed up for this?
We have no speakers, Mr.
Is there
Chairman.
anyone else in chamber who wishes to speak on local law H for 2023? Hearing none, public hearing is now closed. Clerk, please read resolution number 241 for 2023.
The local law of the County of Albany, New York, amending Chapter 106 of the Albany County Code, setting forth requirements for location of substance abuse treatment facilities within Albany County.
Please read the first name.
Allegra Shore.
And remind everybody we have a lot of speakers. I'd like to try to keep your comments to 3 minutes if possible. Thank you.
Thank you very much. My name is Allegra Shore. I'm president of the Coalition of Medication-Assisted Treatment Providers and Advocates, known as COMPA. We're the statewide association representing opiate treatment programs. Those are the methadone programs and medication-assisted treatment programs for New York State. We represent hospitals as well as freestanding programs. There are over 44,000 New Yorkers currently receiving treatment for opiate use disorder in our member programs. Thank you for the opportunity to share our concerns regarding local law number F tonight. COMPA respectfully opposes this proposed law. Methadone has a lot of stigma. It's an extremely effective treatment. It's been around for close to 50 years, and it saves lives, but the stigma is widespread. And that's nothing new. This has gone on for decades. But what is new is the scope of death and devastation that the opioid epidemic has caused and continues to cause in our communities. So I truly understand the fear that people fear when they hear that a methadone program may be opening in their community. But I'm here to tell you that with a good provider operating a methadone program, those fears really are unfounded. There's lots of studies that show that methadone saves lives, that they really operate like a regular doctor's programs. People are not aware that people come and go and are receiving treatment in a good methadone program, and they operate quietly, and there's studies that show that crime gets reduced. So at the end of the day, these really are unfounded. When a member comes to us and says they want to open a methadone program, one of the first things we tell them is, well, you need to go to the community and get some allies, work with the community, because you can't open a methadone program like sort of sneaking in the middle of the night, because you need to work with the community. At the end of the day, you're going to be part of that neighborhood, and so you can't just sort of think you're going to sneak in, because you got to work with the churches, you got to work with the stores, so you have to be part of the fabric of the community. So that's our advice to anybody who wants to operate a good program, and so that's what we encourage people to do. So it's how you become successful. So our concern with this particular law is that one of the big procedures is that this is already actually in effect, that OASIS has actually put in that very knowledge in their licensure program. They advise us to make sure that we contact the local government unit. Now, I think one of the things that happens is that that process happens, but I know this particular law talks about notifying beyond that local government unit. Well, one of the things that we're concerned about is there's certainly enlightened officials that may happen, that certainly in a city like, county like Albany, those people may be notified, but there's also lots of counties that could hear this law, take this up, and this could have a cascading effect beyond this particular county.
Time.
So that's one of our big concerns, that this would really end up with a war and would end up blocking treatment, and people would end up not getting the treatment that they really need. So I hope you'll consider those kind of considerations. We really appreciate your thoughts on this and your consideration. Thank you very much for your time.
Timothy Lane.
Dear honorable members of the Albany County Legislature, for those of you who do not know me, my name is Tim Lane, and I am an elected member of the Menands Village Board. I am a trustee and a long-standing member of the community. For full disclosure, Allison McLean Lane is my spouse, so I don't want to, have any misconception that I'm here otherwise. Please know that this law will not prevent a facility from opening. You may have likely been told this will result in a moratorium, or where it will absolutely not. This is a matter of government transparency. New York State Mental Health Law Section 32 stipulates that applicants for proposed substance abuse disorder treatments be reviewed by the local government unit, as you just heard. Do not be misled. That does not refer to local boards or government officials. That refers to the Albany County Department of Mental Health. In the case of Albany County, the LGU, being the Albany County Department of Mental Health, they're required to review the applicant and approve the substance use disorder treatment facility before it is submitted to OASIS for licensing. City councils, town, and village boards may not address these matters on the zoning level. OASIS informed the village board ourselves that they do not engage in this. Municipalities have no say in the licensing or approval, and what we found in this process being undertaken by them, that it is lax and flawed to a great degree. In addition, it leaves local officials like us and you out of the loop. This law will only require that the Albany County Department of Mental Health notify local officials, town, city, village, as elected officials, of a proposed submission. No more. I feel that's necessary to give you a brief synopsis of the, now I agree with Ms. Shore that such facilities should engage with the community when they come, should let people know about them, do not sneak in, but that's exactly what did not happen in our case. I feel that it's necessary to let you know, give you a synopsis of the occurrences which led us here this evening. In March, while gathering signatures, Allison was advised by a constituent that a methadone clinic was going to open in what had been the Price Chopper Plaza at 444 Broadway. This constituent's home and that of her neighbors abuts the plaza. And due to media coverage and the alarming stories and issues in the Albany vicinity of Camino Nuevo, she and her neighbors were not unreasonably concerned as a result of that. Being a member of the village board, I was taken aback that I was not notified and was not made aware that this had been brought up at the village board. And I brought it up at the next village board meeting on April 3rd. I learned that although the mayor and one of the other board members were aware, the rest, because they had been notified by the building inspector, the one member, as he was the liaison.
Time?
That was 3 minutes ago?
Yeah, believe it or not.
Okay.
They said-
Well, you have copies of my statements, and I just wanted to, let you know that we want you to consider that this is a matter of just transparency. That's all. This is nothing more. Thank you. You have my statements.
Chuck Price.
Hi there, my name is Chuck Price. I'm a long-term resident of Menands and Albany County, in fact, 36 years. And I may surprise some people here, but I have a lot in common with the people who are against this law, because you're going to hear a lot of people come up here tonight and tell you there's an unprecedented opioid crisis, that it's only getting worse, that it's imperative that we get treatment for these people, and they are 100% right. Unlike the lobbyist that was preceded Tim, saying that these operations don't sneak in undercover, that's just not the case, because Laura Harbour in the back is going to tell you exactly how that happened in the case of the village of Menands. Now, we're all committed to resolving this crisis, but our efforts have to ensure that treatment centers that benefit patients also benefit the communities. There has to be a synergy there. It can't be a win-lose. We're looking for a win-win here. Now, a good example of this is Camino Nuevo. So we talk about stigma attached with this, and there's been stigma for decades. What causes this stigma? Perhaps it's a situation that we see at Camino Nuevo, where the number of persons to be seen has exploded past what was originally called for, and they can't handle it. And you have people on the street, and you have needles on the street, and it's a bad situation. It's a bad situation that Assemblyman McDonald wrote a letter to OASIS pleading with them to move Camino Nuevo. That's a problem. The people of Camino Nuevo had no say in having that put in their neighborhood. That's not right. Everyone should have a say as to what's going into their neighborhood. That's all that this law calls for. Local Law 7 will require a close analysis of these patient demographics. Here's another problem. The limited OTPs outside Albany County exacerbate the challenges that Local Law 7 aims to address. And boy, time goes by, doesn't it? So in closing, let me say this. You know, as we consider this crisis' vast ramifications, we can't overlook the residents' rights and voices. And I want to ask everybody that's coming up here to oppose the law, I ask you this question, and it's, why should the rights of a recovering addict supersede a homeowner's rights? It's not right. And this isn't about diminishing one over the other. It's about a balanced approach. My time's up. And by voting yes, the people in this body, you have a responsibility to vote yes on this and to ensure a path forward that's inclusive, compassionate, and effective. It's a vote to empower constituents and demonstrate compassion, supporting a community-backed solution, and show commitment to the people that you represent, not the lobbyists in this room. Thank you.
Mickey Jimenez.
Thank you and good evening. Camino Nuevo was established as the Capital District's first bilingual chemical dependency outpatient treatment program in 2014, under an extension of the OASIS license granted to Promesa, an affiliate of Acacia Network. Today, Camino Nuevo provides substance use and addiction treatment services to hundreds of individuals in recovery. Given the unprecedented rise in overdose deaths in New York State and across the nations, facilities like Camino Nuevo play a more important role than ever in saving lives. Over the years, Camino Nuevo has faced pushback from residents, business owners, and other stakeholders who feel uncomfortable in sharing the community with a substance use treatment facility. We have worked with our community-based and government partners to address any quality of life concerns and have taken additional steps, such as enhancing security and closing on Sundays. We also began to explore a potential relocation. Despite having a current lease at this location and taking into account that such a move would require considerable capital investment to secure and outfit a different facility. We are pleased to announce that after a careful search, we have identified a potentially suitable location that meets the needs of the vulnerable population we serve while fulfilling our mission-driven goals as a nonprofit. However, should this resolution pass, it would take a considerable additional burden on an already challenging process, thus hindering us from moving forward within a reasonable timeline. Be clear, if this resolution passes, we will be forced to stay and remain on the present location on Central Avenue and will no longer pursue relocation. Thank you for your time.
Colin McNamara.
Thank you. My name is Colin McNamara. I'm the Deputy Director of the Center for Law and Justice here in Albany, New York. I rise today to speak in opposition to Local Law F. This bill is onerous, it is unnecessary, it is discriminatory, and it will only have the effect of making it harder to open substance abuse disorder clinics in Albany County at a time when we desperately need more. I'd like to begin by establishing what I hope will be a basic area of common agreement for everyone in this room. Substance use disorder clinics are healthcare providers. Just like dentist office, orthopedic clinics, dialysis centers, they provide a healthcare service. They are healthcare providers, full stop. And yet, this law would not require that we notify a massive list of government officials via certified mail within 10 days whenever we want to open a new dentist office. It would not require that we leave open a mandatory 60-day airing of the grievances public comment period every time we want to open a new orthopedic clinic. It would not require that we then go back and alert that whole laundry list of government officials all over again, still by certified mail, but this time within 5 days instead of 10, every time we want to open a new dialysis center. So I ask you, what is so special about this one particular form of health care that we must seemingly notify everyone with a government title for miles around every time we want to open a new clinic? The plain truth is this. Local Law F unfairly stigmatizes substance use disorder treatment centers and the people for whom it is a necessary, life-saving intervention. It singles out a specific form of health care for heightened scrutiny without reason or justification. It throws unnecessary hurdles in the way of opening new clinics to treat a devastating health condition that is ravaging not only Albany County, not only New York State, but the United States as a whole. The intention behind this bill is obvious: to make it harder to open new substance use disorder clinics in areas that deem them undesirable, unattractive, or dangerous. But I would say to all the members of this body, if you think for a second that your constituents are not in need of a substance use disorder treatment center, you are dead wrong. According to statistics from the Department of Health and Human Services, 25% of Americans, that's 1 in 4, between the ages of 18 and 25, have a substance use disorder. This cuts across all racial and ethnic backgrounds. It even cuts across class backgrounds. You need a substance use disorder clinic just as much in Loudonville as you do in the South End. You need it just as much in Latham as you do in Arbor Hill. We need more health care, not less. We need more clinics. We need more providers. We need treatment options available in rural and in urban areas. This is an emergency. We need to be working towards solutions that get people treatment faster, not embracing legislation that is calculated only to bring out rank NIMBYism. Whether you want to accept it or not,
Time.
substance use disorder is in your backyard. I ask that you act accordingly and reject this bill.
Chris Assini.
Good evening. My name is Chris Assini. I'm a person in long-term recovery and the Director of Policy for Friends of Recovery New York. I'm a person in recovery and currently, always subject to change, a husband, a taxpayer, a homeowner, a professional, a proud dog dad, and mostly a survivor. My 15-year battle with my disease culminated 5 years ago when I was found unconscious and barely breathing. As things looked particularly dire, my parents reached out to friends and family, some traveling from as far as California to say their potential goodbyes. I ended up in a medically induced coma for 16 days, ultimately spending 23 days in the ICU. When I awoke, I was completely disoriented, suffering from extreme memory loss with an inability to move my limbs and unable to recognize my parents or friends. It took me months before I could speak in complete sentences or walk in a straight line. After about 6 months, I slowly integrated back into a daily routine, only to have a reoccurrence and ending up back in the hospital and having to start all over. My story isn't unique, special, or different. I am just lucky. I am lucky I had access to the services I needed so I could start my recovery. For New York has gathered a portion of the recovery community, and we are here to voice our opposition to local law number F. The negative public perception, discrimination, shame, and stigma that surrounds addiction has prevented millions of individuals and family members from seeking help. Name one other healthcare provider treating chronic illness that requires the notification of the Albany County Legislator, who represents the legislative district which contains the proposed location or facility, the Albany County Legislator, who represents any legislative district adjoining the district which contains the proposed location or facility, each city, town, or village mayor or supervisor who represents the municipality which contains the proposed location or facility, each city, town, or village council or board member who represents the municipality which contains the proposed location or facility, each New York State Senate, and Assembly representative who represents the municipality which contains the proposed location or facility, the principal of any elementary, middle, or high school within 1,500 feet of the address for the proposed location or facility. Punitive legislation requiring providers to notify the community at large creates unnecessary barriers, reflects a distrust of patients, which will exacerbate disparities in treatment access and sets a dangerous precedent, pending a legislative roadmap that will reverberate around the state for other localities to follow. This legislation is a deterrent and will be seen as such by providers. To address this crisis, states should expand the treatment offerings, removing unnecessary barriers so people can access life-saving treatment for substance use disorder. Every one of you has family, friends, and constituents who have either used substance use disorder services, are currently using services for SUD, or will need services for SUD. Don't turn your back on them, support them, ensure they have access to the services they need so they can live the life they deserve. Thank you.
Joelle Foskel.
I too am here to voice my opposition to Local Law F, as the impact and objective of this law would be to halt addiction care providers from attempting to locate in Albany County when we are seeing record-breaking numbers of overdose year after year. While working for Senator Harcum, the previous chair on the Committee of Alcoholism and Substance Use Disorder, we initiated a task force on opioids addiction and overdose prevention. During these hearings, we were confronted with the uncomfortable reality that for many advocates who had been fighting the stigma surrounding addiction for decades, progress in the recognition of addiction as a disease was bittersweet, because when the problem was prevalent in communities of color, the solution was incarceration. The drug war was a failed policy that cost us countless lives. We know this now, and we can do better. I thought to myself in 2019, thank goodness we're recognizing addiction as a disease, and we're now meeting individuals impacted with compassion and support. The same compassion and support we would extend to anyone suffering from a chronic illness. At the Interagency Task Force on Overdose, which convened earlier today, we heard from the Department of Health Commissioner McDonald, who showed an illustration that indicated that beginning in 2021, overdose numbers for white New Yorkers has leveled off. Since that time, overdose numbers have continued to rise for communities of color. And only 2 years later, Albany County is now leading the charge in taking up the reins and leading the revamped war on drugs with the war on addiction care providers, creating a notification process that is not in line with any other medical care provider. If the dispensing of a controlled substance were the concern, nursing homes and pharmacies would have been included. The level of notice proposed is more in line with the notice required of sex offenders than it is any medical service required for an ADA protected class. This proposal is stigma at its absolute worst because now we know better. It is our responsibility to do better.
John Coppola.
Good evening. I want to first speak to you as an Albany County resident. I've been here for 45, 46 years. And during my time, when I first moved to Albany, I was a graduate student. I lived on Clinton Avenue. And in my neighborhood, a couple blocks away, was Hospitality House. I'm not sure when they moved to that location, but it was a neighbor. I lived on McCarty Avenue for a period of time, and the Albany Addiction Care Campus was directly across the street from my house. So I know what it's like to be a neighbor of an addiction program. I also know what it's like to work in one. My first job out of graduate school was working for Catholic Charities in Amsterdam, New York. And in that experience, I had multiple occasions where my job really was to advocate for new services and additional services. We had a 2-person outpatient program, which wasn't enough. We had no prevention services, and a lot of other things were lacking as well. So my job was, I felt it was my job to make sure that adequate services were available in the community where I worked. The key to that was that I had to have a good argument for why the services were needed, and then I had to present it to the local community services board and then the local governmental unit, which in this case was the County Department of Mental Hygiene. Now, I would say to all of you that on some level, a good part of your job is already done. You have appointed a person to be the head of your mental hygiene department, which is the local governmental unit. When you hired that person, you hired a person who had to understand mental health, addiction, developmental disabilities, had to be able to understand what are the community's needs, had to be able to understand some of the challenges of placement and location of programs, knowing that, and I'd never experienced a situation where everybody was in favor of the program. And probably the more people you ask, the more you're inviting people who really don't understand the services or don't understand the challenges of locating a service in an area like Albany County. But fundamentally, you have a director of your local governmental unit who is not only capable of doing his job here, but somebody who is seen outside of Albany County as somebody who is really to be admired and who is a leader. He's on the governor's, on the task force for the Opioid Recovery Fund, and was initially the leader of that group. So you have already on your team a person who can tell you, here's what we need to do. So I would suggest to you that it is not necessary for you to put in place something that would essentially do his job for him. That you have the ability to trust what he's saying and what he's proposing. And I would encourage you to oppose this proposed bill as something that's unnecessary.
Mark Fleming.
Yes, thank you for giving me the opportunity to speak. I'm Mark Fleming. I happen to be a Rensselaer County legislator. I was at a grand opening of a men's facility that the ACCA, the Addictions Care Center of Albany, opened yesterday in North Troy, and it was attended by Commissioner Cunningham of Oasis, the mayor of Troy, and the mental health director of Rensselaer County, and myself and several other people that were very much in favor of this endeavor to help the addiction community. And I was glad to be there. I also heard that this local law, so I read, somebody sent me the law, I read it, and I decided to speak today. I was a participant in a program on 2nd Avenue in Albany many years ago, run by Peter Young and Reverend Peter Young and Sister Phyllis for addiction. And I don't think that I was a threat to the neighborhood. I don't think I was a threat to the children in Hoffman Park. And I don't think I'm a threat to my neighbors now. Actually, people probably like me a little bit. They elected me a few times. And so we get asked as legislators many things. We get some silly things, why did they, I don't know, plow Western Avenue, they didn't plow my little dead-end street yet, et cetera. And sometimes we get asked to advocate for somebody for a job or something like that, and it comes to be like a little bit of a moral conundrum. You know the person, and you know the person that asked you to advocate, and you say, I wouldn't hire that guy necessarily. What should I do? Well, I even ask of you guys, you legislators, guys and women, folks, that when you vote on this local law, you vote with integrity, with your heart, and with what you know is right. Whether, if your mother, pretend your mother's looking over your shoulder. If you didn't like your mother, pretend your priest or your rabbi, and do the right thing. I'm opposed to this, obviously. It's nothing more than a not in my backyard directive. So thank you for listening.
Darby Larkin.
Hi, I'm Darby Larkin. I stood in front of you a few weeks ago to beg you not to pass Local Law F. I talked about that I've been talking to service providers across the Capital Region all summer that have consistently reported to me over and over again that they do not have the resources to reach everyone. That there is a waiting list everywhere, their people cannot access treatment. They told me they are tired and they cannot keep operating in crisis mode. Today, instead of repeating myself, I wanted to better explain to you why I'm here, speaking in front of you. Especially because at the public hearing in Menands, I and other folks working in the field or in long-term recovery were essentially accused of working for someone or being paid to be here. That really stuck with me, and it hurt, and I just wanted to make sure that you all know why I'm here today. I'm here because every day I still think about the men and women that I worked with in Warren County Jail. I still think about, let's call her Jane, who had turned to heroin because she was stuck in an abusive relationship with the father of her children, and heroin was cheaper and more available than therapy and housing. MAT was the only thing that kept her alive long enough when she got out of jail to be able to go to DSS and apply for housing assistance, to get to a clinic, to access her MAT, to get to the recovery center and the outpatient center, to get to counseling. We worked our asses off for weeks to make sure that she had an appointment the day that she got out. And let's call him John, who got his MAT down in Albany because that was the only place he could access his medication within a 2-hour drive. So he got up at 5 a.m., said goodbye to his daughter, and drove down to Albany every single day. And I still think about, let's call him Tommy, who was my age and hadn't been lucid in years because of the daily fentanyl and heroin that he had been doing since he was a preteen, because he couldn't afford to live in his own brain because of the trauma and abuse that he had suffered for years. We talked every day for 2 months about how he was going to access his MAT because he knew one day without it and he would overdose and die. And I still wonder every single day if he is alive. We are here and we are in these jobs because we care. So don't tell me you support treatment, but just not here. Don't tell me you support treatment and then put another roadblock in the way when every single service provider in the Capital Region is overworked, beyond their capacity, working late into the nights and the weekends. Because I can't tell them that. The lead law enforcement assisted diversion program in Albany can't tell the folks living in your county mental health parking lot to call, get on the waiting list, and just hold out a few more weeks until a spot opens up. I need you to understand the real concrete consequences that any barriers to expanding treatment are going to have. They are worried about their property values. I am worried about my friends' lives. Right now, people are overdosing every single day on the streets of Albany because they cannot access treatment. There are already needles and empty heroin bags littered all over Albany. I have friends who work in Stewart's all over the Capital Region, friends in EMS in Albany, and they deal with it every single day. People are already dying. You are very lucky if you don't see it now.
Time.
We are here as folks providing life-saving services and folks in long-term recovery telling you what we need you to do, not because we are paid to be here, but because we all know someone who has died from their addiction. And we all know someone whose life was saved because they were able to access treatment. I beg you to vote no on Local Law F, and thank you for your time.
Diana Morano.
Good evening. My name is Diana, and I'm a social worker, and I live in the city of Albany. I oppose this local law. I previously worked with homeless tenants in Albany County. My clients feared stereotyping and stigma walking into my office at a housing organization where they knew that they were in a safe space to receive services. Their previous experiences brought them shame and guilt, and they were scared to get help. What I similarly fear for folks trying to receive services for substance abuse disorder is stigma and shame. I wonder, how are we supposed to encourage recovery if we keep promoting fear? What I believe we should be promoting are safer spaces for addicts to access recovery services without the protruding fear of their communities. To answer a question posed earlier, Just like how housing is a human right, healthcare is a human right. Thank you.
Laura Cal.
Good evening, and thank you for allowing me to speak in front of everyone. I'm here on behalf of my family that's over 100 years in Albany County. I'm here on behalf of my 5 siblings, 4 are taxpayers, 1 is a recovering addict. And I'm here to say that this law, if you read it, does not make any judgment or discriminate against anyone. It's just a notice to notify municipalities and towns and the people that are in charge of those towns. And this is important because of what actually did happen in our small town, our sleepy little 2-police officer town, that a for-profit facility came in and went through the process according to the paperwork that we foiled through local government unit review reports, and every supporting document that got transmitted on the behalf of this facility was flawed. The support from the senator was not even in our district. It was from some other district. There was no letter or any support from the village whatsoever to support the application, yet the application went through. When it got in front of OASIS, I understand there was some public hearing that wasn't really public because no one in our village knew what hit it. We didn't know till after the fact that there were these public hearings that went on until after they passed it. I even understand that the person that represented the facility, their consultant, also was an employee of the state that helped get that pushed through OASIS. We have all written letters to OASIS to appeal the decision, and I want to say to all the folks here that are recovering, congratulations in your recovery. This is not a discriminatory thing. I'm here to support the taxpayers, hundreds of years of taxpayers, and those folks that live adjacent to the facility that had absolutely no say, literally 60 feet from their house. Now, we are all for helping everyone. That's not what this bill is. This bill, this is a bill, correct? This bill that we're asking you to vote on is simply a notice to notify. Just let the taxpayers know what's going on so they can voice an opinion and follow the process through. It's really important. It's very transparent. It's not discriminating against anyone. It's not saying don't find sobriety. And the speakers tonight, I just am taken back because I think it's really upside down. Substance abuse disorder. Substance abuse disorder, isn't that a name for, you're an addict, right? My brother's an addict. My brother's not an abused addict. My brother's just a common addict. That's what he is. And he's in recovery, thank God. He's 66 years old now, but it was a hard road. I lived it my whole life, watching it, the ups and the downs and all of that. No one's denying anybody getting help. I know there's an epidemic and all of that.
Time.
Thank you very much.
Yep.
Thank you all. This is simple. It's a simple thing, notice to notify. That's all we're asking.
That's it, Mr. Chairman.
Is there anyone else in the chamber who wishes to speak on local law F for 2023? Hearing none, public hearing is now closed. Can I get a motion to adjourn? Peter, Clay Lane, all in favor? Aye. Aye. Good night.